Jharkhand Health Minister Irfan Ansari has now visited Sadar Hospital in Chatra, where the bodies of the 7 victims of the air ambulance crash are being kept. The minister has urged people to support ongoing healthcare initiatives in the state, highlighting that plans are underway to build Asia's largest hospital in Jharkhand. He also emphasized that the crash is a matter for official investigation and called for patience as authorities look into this incident. Listen into what Jharkhand's Health Minister Irfan Ansari has said.
20 साल पहले ही हॉस्पिटल बन जाना चाहिए। हम तो 1 साल पहले हम मंत्री बने हैं, 1 साल में तो हॉस्पिटल बनेगा नहीं, लेकिन मैं बना रहा हूँ तो लोग विरोध कर रहे हैं। तो जो लोग विरोध कर रहे हैं मैं उनको कहना चाहता हूँ, थोड़ा मुझे समर्थन दे, सपोर्ट करें मुझे। मैं हॉस्पिटल बनाना चाहता हूँ, झारखंड में एशिया का सबसे बड़ा हॉस्पिटल मैं बना रहा हूँ, लेकिन लोग विरोध कर रहे हैं, हमारे नेता लोग विरोध कर रहे हैं। तो कब तक हम लोग इस तरह अपना सहते रहे, कब तक एक।
Let me in fact go across to Vandana Singh on this. Ma'am, obviously there are questions that are being raised about regulatory oversight, safety that has come into the picture by the Indian Council of Aviation as well. But when we look at such statements coming in from the ministers, ma'am, on one hand they are saying they are going to build the largest, hospital in Asia in Jharkhand, and we have a patient who had suffered 65% burn injuries being transported to Delhi for treatment because there was no such healthcare facilities available, and then we are seeing a plane crash that is taking place due to inclement weather. How are you looking at this situation that is we are discussing in fact?
Exactly, Shivani. It is you're looking at a situation where on one side somebody is trying to score, I should not say this, but brownie points. I look at it where somebody is saying that, look, we were busy in an election meeting, so we did not know. I see a statement like that. On the other side, when I first was responding to you, Shivani, I clearly mentioned a place like Ranchi. Not having a state-of-art medical facility itself is a question mark, because that's a capital. You expect that. You don't expect to hear that, we will build one of the largest hospitals in India, in Jharkhand, in this and that. That is really moving towards a political agenda as I see it. However, having said that, what I really would like to question here is what is the SOP, what is the protocol that is being followed as far as non-scheduled operators are concerned. Whether it's a Learjet, whether it's a Redbird Aviation, and we all know that there were 2 crash landings of Redbird in 2023, that their training academy was suspended. Why wasn't the license taken off? Why is it always at the end that the blame goes to the pilot? Why? What were the maintenance records? If the audit was done by DGCA, the regulator here, then can they open up with the airworthiness maintenance records to the public? Because we want to see where the green ticks were given. Why is it always that we are falling in this trap and we are saying now the AAIB will respond when the black box is recovered and the cockpit voice recorder is there, let the investigation come out, and then the same story after a month and again after a month. We are seeing this happen again and again, and we are at a point where 8 or 9 months have gone. June 12th, where the Air India crash happened, we are still awaiting for the final report. Nothing has come out as yet except allegations towards the pilot family. And here, a Learjet has gone, a Redbird has gone. There's a family, who has spent entire money to educate a pilot. There's a family who has spent entire money to save a life of a person who has 65% critical injuries, and we are talking of an opening up a world-class hospital in Jharkhand. We are talking of being busy in election meetings. I don't think the the country should be running in this manner. I think the government has to look at it very seriously. I think the DGCA has to have its act in order. I repeat, its act in order, because this is not the safety and security protocol that's followed. Non-schedule operators need to be checked thoroughly, and each and every tick that's given by DGCA needs to be re-audited by an independent authority in this case, because there is a definite question mark from my side as an aviation expert to the DGCA, which is the regulator over here. Over to you, ma'am.
Absolutely, absolutely, ma'am. In fact, that's a very pertinent point that you have raised. Let me also take that across to Air Commodore N.K. Mehta. Sir, do you also believe that there should be more scrutiny on such non-scheduled flight operators?
Shivani, the fact is, this particular, I'll just take a minute. This particular C-90 aircraft is pressurized twin-engine turboprop capable of flying at 29,000. It is equipped with all the modern avionics and radar. Short, it is most suitable for the role for which it is being utilized as an air ambulance, because it can take off short runway and more flexible. But the problem is with the radar. When the weather becomes bad, then the radar problem. Having said that, all your panelists have underlined one important aspect: the regulatory body, that is DGCA. Their role has been under question in all the past accidents. If you see last few accidents, everywhere DGCA has come under a cloud. Their functioning is non-transparent. There is a bunch of people sitting here who are not even qualified, I believe so. They are not even qualified for the task for which they are doing it. So there is a need for the government to intervene, and all the accident reports are non-transparent. So now outcome of this accident, at Captain Panesar also highlighted and Dr. Vandana Singh also highlighted, that DGCA has not been acting transparent, and outcome of these all previous inquiry has not been very clear, and I'm very sure out of this will not come. They first attempt is to blame the pilot who is not there to defend his case. That is the problem. So there is a time has come that DGCA overall of DGCA should be done, and it should be done by an external body. DGCA itself is under mess, so there should be a audit of DGCA itself, and it should be overhauled. Otherwise, we will keep on landing up in such situations time and again. Otherwise, the way aviation is expanding in India, there is a need for a good professional regulatory body in place instead of DGCA. That's it.